sleep when I lay in bed. Too much thinking in my head. I don't know what to do anymore. But come on now, tell me the score. Is there anything I can do to get out of these tragic blues? I'm a victim of circumstance. I never really had a chance. I lay down and stare at my feet. You know the world has got me beat.
Welcome to today's edition of Mental Health Matters. Today we're going to be talking about healthcare, and I have two great guests on our show who has a wealth of knowledge about the Affordable Care Act. Stay tuned. So I want to thank both of you all for being a guest on the show today. I know you guys have busy schedules, and so I just want to thank you for coming on the show today. I want to start off by just kind of talking a little bit about who you are and what organization you work for. We can start with you, Amanda.
Great, yeah. My name is Amanda Wallner. I'm the director of the California LGBT Health and Human Services Network, which is a program of Health Access California. And Health Access is the consumer advocacy organization that works for quality, affordable health care throughout the state.
Wow, nice.
Yeah.
And I'm Sherry Grevin. I'm the Director of Public Affairs for Planned Parenthood Marmonte. We are the local affiliate that represents 35 health centers in the state of California. We're the largest Planned Parenthood affiliate in the country.
Wow.
And as a healthcare nonprofit, we are very deeply involved in the healthcare debate that's happening now.
Wow, nice. So what communities do you guys serve? Like what communities do you serve, Amanda?
Health Access is a coalition organization, and so we're made up of Planned Parenthood is actually a member of Health Access.
Nice.
We also represent organized labor, seniors, people with disabilities, children's health,
Nice.
Communities of color, immigrants, and then, of course, the LGBT community, and that's what the LGBT Health and Human Services Network is. We're a network of over 60 LGBT serving organizations that work specifically on addressing health equity for LGBT Californians.
Nice. So where do your clients come from? How do they hear about the services you provide?
The network was started around 10 years ago around health reform, and it really came from the community.
Nice.
So they recognized a need for more of an LGBT voice in healthcare and health reform. And so that's actually how it started, is the community came to us and
Nice.
recognized this need and created this. And that's actually very similar to the Health Access story. Health Access has been around for 30 years now. And over that time has been involved in pretty much every major health reform in California. And again, it was just a recognition of a need
Nice.
for not just, certain constituencies to have a voice in healthcare, but for consumers to have a voice in healthcare.
Nice.
And various different people who represent consumers throughout California are members, and we try to be their voice.
Yeah. Awesome.
Yeah.
Awesome. Well, obviously you guys are doing a good work, so.
Oh, thank
that's
you.
good. So what about you, Sherry? What type of people do you guys, communities do you guys serve?
The Planned Parenthood population tends to be communities of color, low income, predominantly women. Mm-hmm. We have about 10 to 11% male patient population. So it is predominantly female patients.
Yeah.
But because we are a healthcare provider whose main purpose is to provide care regardless of income, where you come from, race, ethnicity, sex, gender, that we are a healthcare provider that prides ourselves on non-judgmental, unbiased care.
Nice.
That we are really part of the safety net.
Awesome.
So it's only about 7% of our patient population that has private health insurance. Beyond that, they are people that are on Medi-Cal or do not have insurance at all.
Wow, wow. And I know before we started the show, we kind of talked a little bit about the proposed budget cuts to you guys' program. And I want to talk a little bit about that because I think it's very important, especially based off what you just shared. Let's talk a little bit about that and why, in your opinion, is it important not to defund this particular program? Let's answer that first.
Sure. So broadly, from the federal government, Planned Parenthood receives two sources of funding. One is called Title X, and that's a family planning grant program that was instituted in 1970 under President Nixon. And it was started so that all women had access to reproductive health care regardless of your income. This was to bring equity of care to all women, that not just wealthy women, women of means, would have access to birth control and low-income women didn't. So this was to bring parity to reproductive health.
Wow.
And so Title X has been in effect since 1970. It has received cuts to the overall bucket of funds, I can call it, over the years. It has received some cuts, but by and large, the program has remained intact and funded.
Good.
But with this administration, Title X is now able to be used as a bargaining chip in states. So as a grant program, the money is funneled to the states, and then the states distribute the funds how they wish.
Wow.
Since 2010, when the state legislatures in America had a big swing to conservative governorships and conservative legislatures, they started enacting a number of anti-women's health initiatives. And one of the things that they did in order to do that was to restrict these Title X funds to certain healthcare providers. For instance, Planned Parenthood. They would decide, say in a state of Texas or Indiana or Kentucky, that if you were an abortion provider or if you were Planned Parenthood, then you could not receive the Title X funds and the monies would go somewhere else. So President Obama in his last year in office started a rule through Health and Human Services that states could no longer do that. That it was illegal to begin with and that they needed to stop it immediately. But then with this new administration, Congress voted to reverse the Obama rule and go back to the days where states could discriminate against certain providers. And so that did pass, the president did sign it, so now states at will can use any discriminatory policy to determine which healthcare providers would receive these Title X funds. But of course in California, we don't practice those discriminatory policies. So if you are a family planning provider, then you will receive Title X funds. And what that means is that if you are low income and you don't have health insurance, that you can get your pregnancy test, your STD test, your STD treatment, all of that covered, and your birth control covered for free through this Title X program. So that's one pocket of funds that we will be watching very closely. The other thing that's at debate right now through the House of Representatives repeal bill and then the Senate version of the healthcare repeal bill is to quote unquote defund Planned Parenthood. And that means that we would no longer be able to see Medicaid patients. We would not be able to be reimbursed by Medicaid. So the federal program Medicaid is for low-income Americans, and in California that's called Medi-Cal. It's our version because we take Medicaid money plus state money combined to deliver healthcare services to low-income people. So even though federal tax dollars are not allowed to cover abortion services, they still do not want Planned Parenthood to be reimbursed for any Medicaid services, period.
Wow.
So if, say, Amanda were to come in for a breast exam and she's on Medicaid, we would not be able to be reimbursed for that service.
Wow.
But for example, if she went to CARES Community Health Center or a different community clinic in Sacramento, they would be able to reimburse for that breast exam. So
Wow.
this provision in the healthcare bill is specifically calling out Planned Parenthood,
Yeah.
saying that we would no longer be able to be reimbursed by Medicaid. And that's over 85% of our patient population.
Wow.
So where would those people go?
Exactly. Exactly.
Yeah, it's really, it's something that Health Access has come out really strongly rallying around Planned Parenthood as well, and a lot of the community clinics, because we see at the federal level that representatives are saying, oh, well, those patients can just go to any federally qualified health center. And even the federally qualified health centers are saying that's not true. We don't have the capacity to take on, all of these patients. In California, Medicaid covers 14 million people.
Yeah.
And so, when we start taking away providers, we're reducing access, we're increasing wait times.
Exactly.
And it really undercuts the spirit of covering people, of giving people health coverage if they can't actually use that health coverage to go in and get a cancer screening. And that's what these provisions to defund Planned Parenthood would do.
Yeah, and I'm thinking too, how is all of this impacting the clients who are getting service through Planned Parenthood? How is it affecting them mentally? How is it affecting them physically?
They're nervous.
Yeah, exactly.
They are very nervous. And it's also not only impacting our patients, but it's impacting our ability to hire people.
Yeah, yeah.
Which is also impacting access to care.
Yeah.
We can't accept a normal patient load if we're losing staff because they think they're going to lose their job.
Exactly.
And we can't hire new people because they think, well, if I can get the same job at this clinic or Planned Parenthood, I'll go with this clinic because who knows if Planned Parenthood is going to have a future.
Yeah, exactly.
So it's impacting the staff,
Yeah.
but of course, yes, it's impacting the patients.
Yeah.
They don't know if they're going to be able to continue coming to us.
Yeah.
They are becoming very aware of where their health benefits come from.
Yeah.
They are understanding that they are on Medi-Cal, that some services will not be covered anymore, and that they would have to go to another clinic. And a lot of them are asking what they can do and how they can help.
Yeah, I mean, recently and I'm not going to name the place. So I was going in for a dental cleaning, and I think it was like the day of my appointment, I was informed by one of the staff members that my regular dentist is no longer with this particular dental company. And I'm like, well, why am I just being informed about this now? And so they was like, oh, we'll hook you up with this dentist and he's good. And, and I'm like, well, no. I said, because I want to have a choice in who I see, And it took literally, matter of fact, I just went to the dentist last Thursday. So it's been like a month, like maybe 6 weeks, because I had to have time to do my research and stuff like that, and that really impacted me. It affected me because I want to stay connected with this person or place that I'm familiar with, and I can only imagine what the clients are going through at Planned Parenthood,
If we are their chosen provider, and now we'll no longer be able to give them service, or they'll no longer be able to come to us.
Exactly.
There was a recent reporter, news anchor, that was describing the situation, and that a man, if a man is up to speed with his healthcare, he will probably know his primary care physician by name. He'll have all of his stats. For a female, it's not her primary care physician that she'll have the same relationship. It's with her OBGYN. That she knows that person. She is continued to go to that same person. for who knows how many years. And so that's the same situation at Planned Parenthood. If we are their chosen provider,
Yeah.
and they come to us frequently, and we have many of our healthcare staff that are on a first name basis with our patients. Our
Yeah.
patients call, they set appointments with that specific person.
Yeah.
So this would be completely upending the very personal,
Right.
private provider that women go to and trust.
Yeah. Wow.
And it's so important to have those connections with your providers because, you know, when you have a regular physician, you know, you have an opportunity to take more preventative measures to
Exactly.
protect your health.
Exactly.
And like you said, there could be mental health impacts
Yeah.
related to having to give up that freedom to choose the provider you want.
Exactly. Exactly.
I think important too, and perhaps Amanda can speak better to this, but with regards to mental health, now that Planned Parenthood here in Sacramento has been providing transgender hormone therapy, that is definitely a patient population that we are worried about.
Yeah.
That for the transgender community, when they are seeking gender affirming health care,
Yeah.
that it is important for them to have access to that in a timely manner.
Yeah.
And that directly impacts their health. And I
Yeah.
know Amanda can probably speak more to that, but then also to the mental health of the transgender population, particularly trans youth.
Yeah.
That if we are one of the transgendered care providers in Sacramento, and we're already talking about the need for more providers, not less, just
Exactly.
in a general medical sense, and healthcare, the delivery of healthcare, I think that that is one very specific patient population I know we're worried about.
Yeah, I mean, absolutely. I'm glad you brought that up, and I could definitely go down like this rabbit hole for the entire show. But you know, those are services that unfortunately you can't get everywhere.
Yeah.
And you know, whether you should be able to or not, you know, in a lot of communities, Planned Parenthood is the only place that's providing transition-related care for transgender Californians. And they're such an important provider for that community that I think, you know, as much as health access is rallying around Planned Parenthood, I think the LGBTQ community recognizes the importance of that even more because of those important services that, you know, are related to their physical transition, but also are very deeply connected to mental health.
Yeah.
For instance, in the transgender suicide helpline released some statistics after the election when folks were worried about their mental health and, you know, and a number of different rights and healthcare, access to healthcare being rolled back. And they saw a huge spike in their number of calls to that hotline in November and December. And
Wow.
they related that. And, you know, again and again, after things are introduced, when things are happening in Congress, you know, this is really affecting people's mental health and putting people in crisis.
Yeah.
And you know, I think it's important to recognize that, and I think it's important to protect the people that are providing services
Yeah.
to folks who are deeply impacted by what's happening.
Absolutely, absolutely, wow. And the decision makers who are making these decisions, I mean, because sometimes when you're not involved directly, a lot of times people just don't understand how it impacts people. I know before we did the show, I was talking about, you know, unless it hits somebody home, backyard, if it's a family, mother, brother, sister, then it's like, okay, you know, it doesn't make a difference to me. But when it starts to affect them directly, then it's when they start to have some type of understanding how it affects the clients who are receiving these type of services.
Yeah.
Yeah. So let's talk a little bit about the Affordable Care Act. What is the Affordable Care Act and what does the Affordable Care Act do?
You want to go for it?
Yeah. So it's the Patient Protection and Affordable Care Act, which is also known as ACA or Obamacare. It did a number of things that have been incredibly, you know, have really moved us forward here in California. First, it provided a number of consumer protections and things that we really like. So, not being able to be denied coverage because of a pre-existing condition.
Yes.
Not being able to charge more because you were sick. Not being able to let's say that Sherry has asthma and she wants to go and get health care. Well, before, a healthcare provider might have said, we'll cover everything except your asthma. We're not going to cover that. Yeah. And so we'll cover everything else about your health care. And then if they could tie something else back to the asthma, then maybe they wouldn't cover that either. That's not allowed anymore. And that's, and I think, when it's one of the things that people really like, but also has been, I think, in a lot of ways underappreciated. Like, people hated when that was happening. Yeah. And it just kind of stopped happening. And I don't think the Affordable Care Act has gotten enough credit for being the reason that those things stopped happening.
Yeah.
And those are some things that we really want to keep. And then the other big part of the Affordable Care Act was the expansion in coverage. And that happened in a number of different ways. There's the young adults being able to stay on their parents' health insurance until 26.
Wow, nice.
That was a big one. I benefited from that for a
right.
minute.
Nice.
There was the creation of the individual insurance market exchanges. So here in California, that's Covered California. And those were meant for people who are, middle income, above the poverty line, but still, maybe have a hard time paying for insurance because it can be expensive if your employer doesn't offer you insurance. Yeah. And this has been really a huge benefit to folks who work in industries that don't regularly provide health insurance or people who are self-employed. Yeah. And the great thing about the exchanges is, the benefits are great. We have these 10 essential health benefits that the Affordable Care Act covers, which include mental health services. And then there are subsidies to help people afford that insurance rate. And so it caps the amount of money that someone can pay out of pocket for health insurance. And, if you're only making, $20,000, $30,000 a year, or if you're making $50,000 a year, only a certain percentage of your income can go toward health insurance. Okay. And so there are subsidies to make sure that people aren't paying these, really high premiums that we often saw before the Affordable Care Act. And then the other way that the Affordable Care Act expanded coverage is through the Medicaid expansion. And in California, that's, we've really taken advantage of that in a big way. Initially, they had hoped that every single state would expand Medicaid to include low-income adults. And here in California, we actually did that. And there are some states that chose not to. But in California, we did. And we have nearly 5 million people who have been added to Medicaid through that. Wow. In a lot of places, it's a third of the population. In parts of the Central Valley, over half of the population is on Medicaid. Wow. And for a lot of folks, this might be the first time that they've ever had health insurance. Exactly. It covers Medicaid, covers adults, it covers children, it helps pay for long-term care for seniors. It's really such an important safety net health program, and that was probably that was the biggest expansion of coverage here in California.
Yeah. Wow.
And that really did a great job at covering the working poor. That previously the Medicaid cap was, I believe, somewhere around 11,000 annually. Right. Like, it was a very, very low number. Yeah. So if you were anything above that, then you didn't have coverage unless it was offered from your employer. But we all know there are many employers that don't offer health insurance. No. And if you are America's working poor, you could be working 50, 60 plus hours a week, probably providing for an entire family and or extended family on that, and still not be receiving health benefits, but you would be above the cap considered for Medicaid. So with the Medicaid expansion to include all adults up to a certain income level, it really closed a gap of America's working poor.
Yeah.
So it did tremendous things, like Amanda said, giving health insurance to people who had never had it before. And immediately, someone comes to mind. She's one of our patient advocates. She had never come to Planned Parenthood before. She was 40 years old. She was self-employed, single mother, and was right at that income level, right at the very top, that was able to be covered by the Medicaid expansion.
Wow.
So she's now covered under Medi-Cal. Previously, she did not have health insurance. And one morning woke up and did a breast exam on herself at home, which all women should do, and discovered that she had a lump, and she was worried.
Wow.
Never been to Planned Parenthood before in her life, but we were the first place she thought of.
Yeah.
And of course, we accept Medi-Cal, so she made an appointment with us, and in fact, she did have stage 1 breast cancer.
Wow.
But because she had insurance,
Yeah.
she would not have had that insurance if it were not for the ACA and for Medi-Cal expansion.
Wow.
And because she had that insurance, she was able to come to somewhere, get a breast exam to confirm, and then we immediately put her into our protocol.
Yeah.
Within days, she had a biopsy, was confirmed, and then I believe within a month and a half was in recovery from a double mastectomy.
Wow.
Because she had immediate access to health care.
Yeah.
So what situation would she have been in? And
Yeah.
this is a single mother, woman of color. What situation would she have been in if she didn't have insurance, she didn't have
Yeah.
coverage,
Yeah.
and if she didn't have Planned Parenthood to go to?
Yeah.
And we know what situation she would have been in, because it's happened to people before. It happened to them before this, before the Affordable Care Act. People
Yeah.
would, they felt, oh, something's a little off. Well, I better, I have to save up, and maybe in a couple of months I can
Yeah.
go see the doctor.
Exactly.
And by that time, you have untreated cancer, and that's a terrible situation to be in.
Yeah.
Or you say, okay, I'm going to go make an appointment, and you can't afford the treatment, and you end up having to file for bankruptcy.
Yeah.
And those are, medical bankruptcy was, has been a huge problem in our country, because of the high cost of medicine, and people who were uninsured who now are covered thanks to the Affordable Care Act.
Yeah. And I like the story. I'm glad you shared that testimony, by the way, because I think it's important for those people who are the decision makers, and for those who are against, the Affordable Care Act, to know just how people's lives are being impacted in a positive way from this health care plan. But one thing I do want to talk about too is the penalties for those that are not enrolled in a health care plan. I think that's important, and some people may disagree. And the reason why I think it's important, because it puts people in a situation to actually have health care coverage. So, I grew up in an environment where, we just didn't have health insurance growing up. And because of that, a lot of people, they didn't get a lot of preventive measures, things that should have been taken care of. They didn't, dentists, doctors, or anything. And so what happened is they kind of grow up and they get used to that. It becomes the norm to them. But with this Affordable Care Act, the penalties, they will get penalized, they pay a fee. And, I think that with that, it'll motivate them to get this health insurance, even if they don't use it right away. At least they have the option to use this, so.
That's the idea.
Exactly. So I think that's,
And it's so important. I mean, that preventative care is so important. You know,
Yeah.
one of the things that we have seen come out of, you know, there are a number of ways in which we've already seen people actually accessing healthcare
Yeah.
has made them healthier.
Yeah.
You know, and some of those things are things like asthma, which I don't know why that's the example that
Yeah.
came to my mind earlier also, but you know, we've seen the number of emergency room visits in the Central Valley for asthma attacks go down.
Wow.
Because people have access to preventative asthma care.
Yeah.
And I know we were talking about some of the preventative reproductive effects as well.
Yeah.
Absolutely. So through the Affordable Care Act, one of the essential health benefits was that birth control now was no copay. So your insurance company could not charge you, say, a $10 or a $50 copay in order to get birth control. So now birth control was free. So this meant 55 million women in America getting free birth control. So with that one preventive measure has now meant a 5-year consistently lower and lower every year
Wow.
of unintended pregnancies in America. We are at a 30-year low in unintended pregnancies. So to bring this very current, the CDC released a report just last month of the 2016 pregnancy rates. And it showed yet another decline from 2015. So 2015 was already a record low.
Yeah.
It decreased even 9% from 2015 to 2016 of teen pregnancies alone.
Wow.
So we are making incredible gains that when you give women access to birth control, you make it free.
Yeah.
Women will use the birth control method of their choice.
Yeah.
They are taking their family planning into their own hands, and that shows that women can have economic freedom,
Yeah.
that they can then decide if, when, how they start a family. So what the report also showed too is that you have a decline in pregnancy for unmarried women. So what that also means is that, of course, that should not be a problem if an unmarried woman bears a child.
Yeah.
But the data here shows that women are using this preventive measure to plan their families for when they are ready.
Yeah.
So you have a very intentional pregnancy
Yeah.
versus an unintended pregnancy.
Yeah.
So we're at an all-time low for unintended pregnancy, an all-time low for teen pregnancy, and an all-time low in our country for abortion. Since Roe v. Wade was passed, we are at the lowest rate of abortion we've been in America.
Wow.
So if we want to continue moving in this right direction, then we have to stay focused on preventive family planning measures.
Yes.
We cannot turn back. And that's
Yes.
exactly what's happening with this legislation.
Wow.
You have a Congress and an administration that wants to turn the clock, literally.
Yeah. Wow.
We're 2017.
Yeah.
It should not be radical that women have access to birth control and the birth control method of their choice.
Yeah. Wow.
So through preventive health care, people can take control of their lives.
Yeah, yeah. Let's talk a little bit about the American Care Act. Let's talk about some of the things that this administration is proposing. So, you know, let's let
Yeah.
you guys get the floor on this.
Yeah, absolutely. So this spring, the House of Representatives passed the American Health Care Act. It was their repeal and replace bill for the Affordable Care Act. And they did it through the budget reconciliation process so that they could get it through the Senate without having to get any votes from Democrats.
Wow.
That's their hope.
Yeah.
Is to run a process that is kind of closed off.
Yeah.
And so the AHCA, the American Health Care Act, which passed through the House, when the CBO looked at it, the Congressional Budget Office, which is a nonpartisan analyst, took a look at the bill. They said that 24 million people would lose health insurance.
Wow.
By the end of the time that they looked at. And
a large part was because they wanted to roll back this Medicaid expansion that we were talking about.
Wow.
So we talked for a little bit about the great things that happened when they raised the income level and they raised the restrictions on who could receive Medicaid.
Yeah.
So in order to repeal Obamacare, one of those provisions, of course, was the Medicaid expansion. So in order to roll that back, they wanted to bring that to an immediate halt, take some of those people off of insurance, and that's really what we're seeing an uproar about.
Yeah,
but I'll let you.
I mean, that's a huge piece of it. They're not just talking about getting rid of the Medicaid expansion. They're talking about getting rid of 50 years of progress that we've made since Medicaid was first introduced. A program that covers here in California, like I said, 14 million people.
Yeah.
And they're putting the entire program in jeopardy by capping it.
Yeah.
So right now, the state of California has set an eligibility determination for who can receive Medi-Cal coverage. And so, like we discussed, that was recently increased to cover more people in California.
Yeah.
And what will happen is no matter how many people that includes, so right now it's 14 million. If tomorrow it's 13 million and the next day it's 15 million, no matter how many people meet that eligibility requirement, the federal government will put in whatever amount of money is needed to cover their health care. Yeah. That's how Medicaid works, and that's how it has worked, with matching dollars from the state.
Yeah.
The way that they're proposing to change it would be that they're going to cap the amount of money they're going to spend on Medicaid.
Wow.
And so that means that, over the course of years, and California has estimated that the current Senate bill would cost them $30 billion a year. Because of the cap on Medicaid.
Yeah.
Because of that, they're going to have to make a lot of really difficult decisions about, who remains eligible for Medicaid. Do we have to say to the folks that just recently got coverage that, you're not going to be eligible anymore? Or do we say, sorry, I know you like going to the dentist, but you can't anymore?
Yeah.
Do we take away different benefits? Do we, do we take away health care? Do we stop paying for long-term care? Those are the kinds of trade-offs that they're forcing on states through this cap that they're talking about.
Wow, man, and it's like, and I was saying earlier, before we started, how do you comfortably sleep at night, knowing that you was part of, pushing this?
Yeah.
And to bring that point home specifically, how can you sleep at night? They want to repeal the 10 essential health benefits we were talking about earlier.
Yeah.
One of those essential health benefits is to cover maternity care.
Wow.
So that is something that they actually used as a bargaining tool when the House of Representatives was first debating this.
Wow.
That they wanted to remove that provision that insurance companies no longer have to cover maternity care.
Wow.
How can you sleep at night?
Yeah.
To answer your point.
Yeah.
How can you sleep at night if that is something that you are willing to say, okay, I'll vote for this bill now because that makes it cheaper for insurance companies to not offer maternity coverage.
Wow.
Now that is something that's mandatory.
Yeah.
Because that was a provision that allowed insurance companies to upcharge someone.
Yeah.
So, for example, if you are a woman and you and your husband are now starting to plan for a family and you want to make sure that your health coverage is going to cover having a baby, that now you're seeking to add that provision to your coverage.
Yeah.
Now you're a sitting duck. The insurance company knows you need it, and they're going to charge you whatever they want because you're going to pay it.
Yeah.
Because without it, what are you going to do?
Yeah.
So they were absolutely financially taking advantage of people that needed that provision.
Yeah.
So the ACA made that illegal.
Yeah.
That health insurers had to cover that. You could no longer prey on people that wanted that coverage.
Yeah.
So in the final debating hours of the AHCA, which is the House of Representatives version of the bill,
Yeah.
that was a provision that they stripped.
Yeah. Wow.
And that made it better for some Republicans to vote for it.
Wow.
In their eyes, that made the bill better.
It was the carrot.
Yeah. Yeah. And women need, maternity care when they're pregnant. They need that care.
Absolutely, and it's better for everyone. It's better for us as a society to cover maternity care, you know? And so it is. It's really unthinkable.
Yeah.
That was something that was enticing.
Yeah. Wow. So how have the Affordable Care Act, because I want to talk a little bit about the mental health piece. I know you kind of talked a little bit about it earlier. But how have it changed access to the mental health services?
Yeah, the biggest thing, the number one thing, which I will keep coming back to, is coverage. Is people having health coverage who didn't have it before.
Okay.
Here in California, that's about 6 million people thereabouts who have health insurance now and didn't have it before. And then the other piece of that is that now insurance companies have to cover mental health care at the same level that they cover physical health care,
right,
if they cover mental health at all. And so because mental health care was one of the 10 essential health benefits, that now meant that California could include it in its Medicaid program.
Yeah.
And that didn't just expand mental health access for the roughly 4.5 million people who gained coverage through the expansion, but that actually expanded mental health access for everyone who was on Medicaid here in California. It means that you have access to individual and group therapy.
Good.
It means that you have access to a psychologist. It means that you have access to whatever medication you may need. It means that you have access to treatment and recovery services for substance use disorders. It's been huge.
Yeah.
It's been probably the biggest expansion of mental health coverage in my lifetime. And in California, we're really lucky to have Prop 63, right?
I was just going to say, yeah.
Which is a huge amount of money.
Yeah.
But by comparison, Medi-Cal is it's bigger than the University of California, the CSU, and the community college budgets combined.
Wow.
It's the biggest piece of the pie in our state budget, and it covers millions and millions of people. And when we look at our public mental health system, the majority of people aren't receiving mental health care through Prop 63. They're receiving it through Medi-Cal.
Wow.
And so it's so important that we protect that expansion because it's been really huge.
Yeah. So what can we do as a community to make sure that our voice is heard? Mm-hmm. What can we do? I mean, as a community, and especially the clients who are receiving services through the Affordable Care Act, and what can they do? What can we do to push back, so to speak? Do we just sit and wait for them to make a decision? Can we write letters? Can we, go down? I mean, what can we do?
I'd say the number one thing is to share their story.
Okay.
So at Planned Parenthood Marmonte's website, ppmarmonte.org, I believe it's on the bottom of the screen.
Okay.
There is a place on the website for you to share your story. So if you have ever been a Planned Parenthood patient, you can go to the website and share your story about how Planned Parenthood helped you at any point in your life. And oftentimes, Planned Parenthood has been a game changer.
Yeah.
That it has given someone options counseling, or it has given them an STD test and treatment and changed their health trajectory, or it's given them the birth control option that was best for them, and
Yeah.
now they're able to finish college or
Wow.
wait until they're ready
Yeah.
to start a family. So really, access to birth control can be a game changer in someone's life. And so often for women, Planned Parenthood was the first place they ever received their birth control.
Yeah.
So the first thing I would say to anybody that wants to speak up would be to tell your story.
Yeah.
And I think that's the same for anybody that has received benefits for the first time from the ACA or from Medicaid expansion. If they've had mental health coverage for the first time and it saved their life, these are all stories that people need to share. And I know that at different town halls that members of Congress have been holding, people absolutely have stood up and said, this is my story. This is
Right.
the provision in the bill that has saved my life or my husband's life or my family's life. Why are you going to take this away?
Yeah.
Or to some of the more champion members of the ACA, please save this.
Yeah. Yeah.
So people really need to speak up.
Yeah. Yeah.
I wholeheartedly agree with that. I mean, Health Access has also been collecting stories, since we realized there was a threat to the Affordable Care Act. And if you go to our website, health-access.org, you'll see share your story link right there at the top, because those stories are the things that really move people.
Yes.
And we've gotten hundreds of stories by reaching out, but we know that there are thousands more out there.
Yeah.
And so I wholeheartedly encourage folks to share their story. Whether they received treatment at Planned Parenthood, or whether they signed up for Medi-Cal, got a cancer screening. Whatever your story is,
Yeah.
that's an important piece of that fight.
Yeah.
When the media covers this, they want to talk to people whose lives have been impacted.
Yeah.
We've heard from people who were able to start their own businesses because they finally felt comfortable to leave the security of their job that was giving them health insurance, because they now had the option to go into the private market and buy it for themselves.
Nice.
And were able to afford it
Exactly.
Nice.
themselves. So prior to working at Planned Parenthood, I worked for the House of Representatives. I worked for 2 different members of Congress. And at that time, I was working for a member when we were debating health reform in 2009. We would hear stories from people all the time, and one I will never forget. It was a husband who was from a very affluent community in the congressional district that we represented. His son had acne, very bad acne, and the father had a poor ankle from a previous injury that had never properly healed. Because of that ankle injury and the son's acne, they were uninsurable.
Wow.
So when we talk about pre-existing conditions, we're not just talking about breast cancer
Right.
or asthma or diabetes. We're talking simple things like acne and an old ankle injury.
Yeah.
So while this family made all kinds of money, they could afford a plan out on the market.
Yeah.
That didn't matter. They were uninsurable. So we're talking about a very wealthy, affluent family. Take any other family
Yeah.
who is not the 1% or even the top 5%. Take
Yeah.
any other family and they would not be able to afford anything.
Yeah. Wow.
So to that point, yes, there are so many. We heard from many of them that they felt tied, completely restricted to a job that they didn't like, that they could not move up in, they could not change the course for their family. They were tied like an anchor to this job because of the benefits.
Wow.
And now that was one of the economic arguments for the ACA,
Yeah.
that if you were able to provide affordable health insurance options to people, that they would take them.
Yeah.
And that would release them economically from jobs that they did not want to be at and could instead forge a completely different economic path for themselves or their families, because now they could afford insurance on the market.
Yeah, absolutely. There's so many ways that people have been impacted by the expansion of healthcare. And if you want to get involved beyond sharing your story, there's lots of ways to do that too. There's lots of other ways. Health Access is the co-chair of the Fight for Our Health campaign here in California, which is a campaign made up of over 150 organizations throughout the state that are working to protect the healthcare gains that we've made over the last few years since Obamacare has been in effect. And over the course of the last few months, we've held over 75 events throughout the state, everything from die-ins to empty chair town halls, and really holding members of Congress accountable. Those ones where we're like, how do you sleep at night?
Yeah.
Showing up to their town hall and asking them, how do you sleep at night?
Yeah.
And then having them lie to you.
Yeah, I'm sure.
Has been
that happens
a unique
too.
experience.
Yeah.
Yeah. And so, there are opportunities for individuals to get involved in a lot of those efforts. We've seen groups like Indivisible spring up that have really been fighting back against the healthcare bill. Organizing for Action, Planned Parenthood, all of these groups are coming together to coordinate the push against this repeal bill. And if you go to fightandresist.org, you can see all of the events that are being updated very regularly.
Throughout the state.
Throughout the state, yeah. And you can search by region, and you'll find phone banks in your area that are happening every single week, where you're calling and you're maybe sharing your story or sharing why healthcare is important to you with another person like yourself in another state, and trying to say, is this as important to you as it is to me?
Yeah.
And if it is, call your senator too.
Yeah.
Because that's who they need to hear from. They need to hear from their constituents.
Yeah, and I'm glad that, and I like the way that you two presented that, because so many people think that they can't do anything about it. They feel like, I'm not gonna vote, or I'm not gonna go to this town hall meeting, because they really honestly think that their voice is void in the situation. But in fact, it's the totally opposite.
Absolutely.
It's the totally opposite. So what would you guys say to, because we got like 3 minutes left, but I want to hear, what advice would you give somebody who feels as if their voice is not important on a matter like this, when in fact it is important, because the decision that this administration is trying to make is going to directly affect them? How would you encourage them to get out there and get involved?
I would say use your social media for a new reason.
Okay.
Get on your Facebook, get on your Instagram, get on your Twitter, get on your Snapchat. That if you love to take selfies,
and people do.
Why not take a selfie with a sign that says why you support healthcare, why you need your healthcare, why you need your insurance.
My pre-existing condition is, we've seen a lot of those selfies.
Nice.
That or take a video.
Yeah.
Take a self video saying why you support Planned Parenthood, why you stand with Planned Parenthood.
Yeah.
Or call out your member of Congress. Say thank you for standing up for healthcare reform. Or if your member of Congress does not support the ACA, if they are going to vote to repeal, then you need to say, Congressional member Susie Sunshine, that I received benefits this way through the ACA. Please do not repeal. And then tag your member of Congress in this post.
Yeah.
So that is one simple thing that you can take a minute to do. If you spend 40 minutes a day on Facebook, take 1 minute of that and share your story and amplify your voice.
Okay.
Absolutely. You can use the hashtag #StandWithPP, Fight for Our Health. And I would just say, you have a lot more power than you realize. Your members are listening to you. The media is following the stories that they think that you care about. And so
Yeah.
when you do things like you talk about this on social media, you're showing them, you're showing the media, you're showing your member of Congress that this is something you care about, that people care about, and that's what we need in this fight.
Okay, thank you guys so much. This was a lot of information, and I'm hoping that somebody is really impacted and learn a lot about this particular show.
Yeah. Thank you so much for having us.
Thank
You're
you.
welcome. You're welcome. And that's it today for this edition of Mental Health Matters. If you have questions about this particular show, if you want a DVD copy of this particular show, please dial 916-366-4600. Thank you.
When I think of where I've been, the good times and the bad, on a scale of 1 to 10, either way I'm glad, 'cause I'm not alone. As I'm reaching for the phone, your voice is there, you really care, you're my comfort zone. Sometimes when I'm lost, crushed beneath the pain, though I can't afford the cost, I just smile and play the game. But there's a healing place where I cannot pretend. Your smiling face, your heart's embrace heals me again. So even when the storm is strong and I'm deaf to my own cry, I faintly hear a distant song and I simply can't deny that I'm not alone. 10,000 times I've known my best bet is that first step for hope. Trying to stand tall, I'm haunted by the past. With my back against that wall, one thing is clear at last. The kind of love you show to me flows from an endless stream, with shore so wide it won't subside. My mind had never dreamed how I'm not alone. Even when I'm on my own, your gentle touch is much too much to let me roll. So even when the storm is strong and I'm deaf to my own cry, I faintly hear a distant song and I simply can't deny how I'm not alone. 10,000 times I've known my best bet is that first step for home. When I think